Congratulations! You've now made it to the final module of the IACAPAP MOOC. I'm Dr. Julie Chilton, Assistant Clinical Professor at the EL Child Studies Center in New Haven, Connecticut, and an Associate Editor of the IACAPAP Online Textbook of Child and Adolescent Psychiatry. I'll be joined by Dr. Henrika Clausen in a few moments to tell you about where to go from here and how to continue your journey learning the basics of child and adolescent mental health. During this module, I'd like to reflect on all that you've learned and think about how to continue building your knowledge base. My goal is to give you a few ideas of how to keep learning about child and adolescent mental health through free and online resources that are available. But first, again, way to go. You've completed 20 plus modules on the basics of child and adolescent mental health. You've learned from experts in the field from all over the world. You've taken many quizzes and participated in active online forums to solidify your knowledge. And if you'd like to purchase a certificate of completion for the MOOC, you can do that now. You are likely a group made up of diverse individuals: teachers, parents, patients, nurses, social workers, community health workers, psychologists, general psychiatrists, pediatricians, medical students, and trainees. There are many possible paths forward for each of you. I'll try to show you some of those now. In this module, I'll be speaking about many possible ways to keep learning. Some of these include free online textbooks, for instance, IACAPAP and Goodman, national and international organizations that have websites with great resources, like the American Academy of Child and Adolescent Psychiatry, the ADAMSEP, the MindEd, scholarships for travel and attendance at child and adolescent mental health conferences like IACAPAP or ACAP, and two different ways to have experts in child and adolescent mental health come to your town, wherever you are, to both teach and learn from you and your colleagues about child and adolescent mental health. So first, I'd like to tell you a bit about our IACAPAP online textbook. Many of the modules in the MOOC are based on the chapters in the textbook, and if you'd like to learn more about any of the topics covered in the MOOC, the free online textbook is a great place to start. The wonderful thing about having an online textbook is that it can be kept up to date with the latest developments in child and adolescent mental health, and there are video clips of patients to watch, links to more online lectures, useful rating scales, and important research articles. There are also many resources for teaching, end-of-chapter questions, clinical exercises, as well as PowerPoints that anyone can download, customize, and use to teach for free. Also on the IACAPAP website is the IACAPAP Archive. This is a place where professionals in the field of child and adolescent mental health have the possibility to upload clinical or research documents in their own language. An abstract in English will be provided as well. These documents are then freely available for all Internet users. Their quality is guaranteed by formal approval from the National Child and Adolescent Mental Health Organization of the author's home country. Another online resource that is excellent is the Goodman Textbook of Child and Adolescent Psychiatry. Rather than being a live virtual textbook, it is actually a free scanned version of a paper textbook with many evidence-based, multiple-choice questions to help cement your learning. The American Academy of Child and Adolescent Psychiatry, or ACAP, has a website with many resources for teaching and learning. Some are geared for patients and families to better understand mental illness and available treatment, and other resources are for clinicians, providing guidelines on standards of care for psychiatric problems and issues that come up during treatment. Online, at their website, you will find 12 resource centers, 40 practice parameters, 117 facts for families, 3 medication guides, and extensive policy statements. A new initiative was begun this year by ACAP's new president, Dr. Paramji Joshi. It focuses on creating resources for the international community, people like you. It includes membership fees at reduced rates, training opportunities, a catalog of free online educational resources for both members and non-members, a list of many international organizations involved in child and adolescent mental health, and a calendar of international meetings. ACAP has also established 2 new different international scholarships. These awards are open to all international physicians, for instance, pediatricians, family medicine doctors, adult psychiatrists, child and adolescent psychiatrists, and any type of physician who primarily works with children and adolescents providing mental health services. These awards will be for the amount of $2,500 to be put towards annual meeting registration, lodging, and travel for the ACAP annual meeting beginning in 2015. In addition, the awardees will be supported by voluntary mentors during the annual meeting. IACAPAP has a travel scholarship as well. It is named the Donald J. Cohen Fellowship in honor of our former president, Donald J. Cohen. It's a training program for young scholars that's held during the IACAPAP congresses. During these congresses, the fellows will have social activities planned, meetings with experts, and will give a poster presentation. Registration, lodging, and travel will be supported by the award. The Association of Directors of Medical Student Education in Psychiatry is an American organization of psychiatric educators dedicated to the education of medical students in the behavioral sciences and psychiatry. ADAMSEP, as it's called, has developed online modules for teaching child and adolescent mental health. Particular topics covered include child and adolescent eating disorders, post-traumatic stress disorder, and depression. Another resource full of online programs to learn about child and adolescent mental health is from the United Kingdom through an organization called MindEd. It has over 250 modules online related to the health and welfare of young children and teens. It's designed for anyone working with children and teens and was created by United Kingdom medical, nursing, and mental health agencies and funded by the Department of Health. It is free and completely open access. Another great resource, especially for learning about medication, is the Psychopharmacology Institute newsletter. It is authored by Dr. Flavio Guzman, a practicing psychiatrist and adjunct professor at the Department of Pharmacology and Neurosciences at the University of Mendoza, Argentina. This free online newsletter has illustrated video presentations, expert interviews, and updates on new medications. Several international organizations have great online resources as well. The World Health Organization, which you'll hear about later, issues many reports and supports initiatives in the field of child and adolescent mental health. The World Psychiatry Association has a section on child and adolescent psychiatry, and they publish a free journal online, which you see here. Additionally, ESCAP, or the European Society for Child and Adolescent Psychiatry, publishes a peer-reviewed journal that is free online, which you see here on the right. The World Health Organization has developed a teaching tool used in many low and middle income countries to teach child and adolescent mental health. It is called the Mental Health Gap Action Program, or MHGAP for short. It teaches basic interventions for the major mental, neurological, and substance use disorders, including childhood onset conditions, in primary and secondary care through the adoption of task sharing and task shifting approaches. It has been successfully implemented in more than 60 countries. The MHGAP guidelines for assessment and management of emotional disorders, behavioral disorders, and developmental disorders in children and adolescents have been updated and expanded recently. You can find out more about how to request a training in your area by going to their website and requesting more information.
I'm Henrike Klaasen, and we have met earlier in the course when I told you about evidence-based medicine. Congratulations, you've now completed the course, and I want to tell you about a very special offer we have for some of you. So the following section particularly applies to those of you who are a future pediatrician or psychiatrist, a GP or mental health officer regularly seeing patients with child and adolescent mental health problems, or someone involved in supervising or training primary health staff using MHGAP. Another professional who regularly is consulted by children with child and adolescent mental health problems, for example, a clinical psychologist, might also be interested in what we have to say. I've frequently visited places, regions or countries where there's very little in terms of provision for child and adolescent mental health care. If you're from one of those places and you have done the course, you might be very interested. You might think, oh, well, this patient I saw last week who has been raped and is HIV positive and suddenly refuses medication, maybe she has post-traumatic stress disorder, or maybe she's depressed. But at the same time, you might think, well, even after the MOOC, I don't quite feel myself secure enough to actually assess, diagnose, or treat real patients after just having read a book or doing an online course. You might also think, hey, in my country there is very little for child mental health, and how can I actually implement what I have learned in my hospital and within my culture and the limited resources we might have? So you're right, those kind of things are very difficult. And this is why we have developed a face-to-face clinical course, which will help you with practical skills and service development. This course is called the ICAM training. So what is it? It's a locally taught face-to-face course, which takes about 24 to 30 hours. It is aimed at second-line staff, initially mainly pediatricians and psychiatrists and their trainees, but others can apply too. It is very much based on skills and competency so that you can really apply and implement what you have learned. It is very related to the WHO MHGAP and also to the MOOC, but it broadens and deepens what you have learned in those courses. It is culture sensitive and adaptable to your own needs. It covers the most common child and adolescent mental health problems in the local context. So in one region, they might have eating disorders, whereas in another region, they might have a lot of problems with HIV, which are less frequent in other regions. It will be taught by an experienced international volunteer trainer, and it uses ongoing evaluation and quality improvement to really deliver what people need. So how does it work? How can I actually host such training? Well, the main condition you have already fulfilled. This is that you have participated in a MOOC. What you now need to do is that you need to create a critical mass. We find if there is only one person in an area who is interested in CAMS, it's not really enough. You need to find about 10 professionals in your country or region who want to take child and adolescent mental health services forward. Those can be psychiatrists, they can be pediatricians, they can also include clinical psychologists or GPs. You need to ask these colleagues of yours to do the next MOOC, because we really want about 10 people who have actually already done the MOOC. It is very useful if you can find some sort of institutional support. In some instances, those have been universities. Very often they are required to teach some child mental health anyway. So for example, pediatric or psychiatric departments. They can also be NGOs who are interested to help with this. It would be good if you can contact regional or national child psychiatry services, if they exist, for support, because you don't want to put yourself in competition to them. And they will also be really helpful to serve as local trainers for the ICAM training. And then you have to just contact us as potential hosts, and we will send you further information. Now, how does it work? What will IACAPAP or the ICAM training do? Once we have received your application that you're interested, we will try to match you to a suitable senior and junior trainer. So we have a database of psychiatrists who would be interested to help people who are building up services. We have split them into senior trainers who are experienced child and adolescent psychiatrists who have broad teaching and training experience. And we also have junior trainers. They might be child and adolescent psychiatry residents or young specialists, and we find them very helpful to help with the teaching, also to engage with young psychiatrists abroad. We have a bunch of teaching materials, including PowerPoints, videos, role plays, and instructions for exercises and group works for a number of sessions. Some of them will be core sessions, which everybody might want to do. Other ones are also elective sessions. We also provide full evaluation sets because we want to know whether what we do is useful and how we can improve it. So once you've found a trainer, you will just communicate directly with each other. With each other, you will decide on a time, place, and duration of training. As I said, it's minimum 24 hours. But that could be in different ways. It could be 4 days of 6 hours a day, or it could be, for example, a weekend and 5 evenings. It really depends on the availability of the trainer and also of your staff. You can do it part-time, as I say, for example, a weekend and a week of evenings, but maybe you also have the chance to do some full days during the week. We advise really not to do more than 6 hours of teaching per day. It really gets too intensive otherwise. You do need to do some preparation in addition to the MOOC before the course. And this is now, as you have done the MOOC, you need to be on the lookout for patients who might have mental health problems. You need to take one and write a case report. You will find in the IACAPAP textbook how to do that. And we'll send you instructions as well. You should also take a video of a child because it's important if we give the course that we take your kind of patients that you see and don't tell you about the expression of disease in maybe another cultural context. As a host, you will be expected to provide local accommodation, transport from the airport, and also food during the training. The trainer is responsible to do this in their free time and to provide traveling expenses. We might try to get a grant and we will also give some fundraising advice. But at the moment, this is how it works. So there are no further costs for the host, no costs for the teaching, etc. at all. This is all done on a voluntary basis. I do have to warn you, however, that it will take some time to actually set up this training. It might take up to a year, really, because you have to prepare, you have to get the dates, you have to get it onto your own schedule. So just from doing the MOOC to doing the training, count on 9 months to a year. Otherwise, you might be disappointed if it's not moving quickly enough. So once you have done the MOOC, once you have done the training, you can actually gain an international recognized certificate from IACAPAP. I think that will also give you something which you can use for application, which you can hang up in your office, and which will actually be something that you can also get out of it. To be eligible for this certificate, you have to participate in the MOOC, which we have done. You can also do equivalent teaching. The MOOC exam will be repeated at the beginning of the ICAM training because you have taken it online already, but we actually want to see you doing it yourself. You will have to supply a written case report and a recorded video interaction with a family or a child. You have to participate in the ICAM training, minimum 80% attendance. And at the end of the ICAM training, there is also an objective structured clinical examination where you will do a role play in which you will assess a patient or give psychoeducation, and we will see how you do in this. And you have to fill in all the evaluation materials. Now, maybe you are thinking, actually, is it worthwhile? This sounds like a lot of trouble to go through. We've done one pilot of the training, and in fact, the participants really loved it. 81% of them said it was really excellent, very clinically relevant. The quality of the teaching, and also the first time we did it, was rated by all of them as excellent or good, and also of the teaching materials. What kind of things they said? The course gave me an insight on how to approach children with psychiatric disorders. It was relevant, comprehensive, and practical. And the best thing for me, they said, was the process as a whole, the role plays and the teamwork, and just feeling that you're not alone. So, is it worth it? Well, we think yes, the children are worth it, because there is no child health without child mental health.
Thank you, Dr. Claassen. So from this module, you've learned about a wide array of further learning opportunities, from online modules to online textbooks to international travel scholarships to being able to host further learning in your own country. Whether you are a community health worker, a parent, a nurse, or a physician, there are further high-quality resources available for learning about child and adolescent mental health. As you learned in the evidence-based medicine module, there is much work to be done to take care of the world's children. Remember, 50% of all chronic mental health problems start before age 14. Suicide is the third leading cause of death in youngsters, and child and adolescent mental health is one of the largest contributors to the global burden of disease in adolescents. Luckily, there are many organizations out there trying to address this problem, but they cannot do it alone. Use these resources available that are free and online to maximize the care provided for the children in your community. Thank you for listening, and again, congratulations.